Hi, I'm Kevin Dandy, physical therapist at Virginia Therapy and Fitness Center. What I want to talk about briefly is how you can optimize recovery from an injury at home. We used to think about RICE, rest, ice, compress, and elevate when you had an acute injury. We've modified that pretty significantly. At this point, I'm going to run through that for you. The new model that we're thinking about is peace and love, okay? Rule number one, you want to protect. Whatever we can do to help the body continue to heal, whether it's ligament, muscle, tendon, disc that may have been injured, we want to do things to protect that. Elevation is still fine, especially with extremity, arm or leg, getting that above the heart. Excellent, good idea. We want to avoid anti-inflammatories. In the past, we always thought taking anti-inflammatories to reduce inflammation was a good thing. Not accurate. We actually want to allow the inflammatory process to take place. That's how our body naturally heals itself. There's some pain involved with it, but it's actually equating to healing. So we want to make sure we're maximizing that by not taking an anti-inflammatory. Compression is still good. You can use some sort of compression garment to give you some compression, improve healing with that. And just from an education standpoint, know that your body will heal itself. You can get back to your normal activities, but it may take a little bit of time. For example, of a basketball player who's just sprained their ankle, you're not going to go out and immediately get back on the court again. But being able to load the ankle, walking, that may be advantageous. Or if you don't tolerate walking, it may be even just doing some gentle ankle, active ankle movements to really help support and facilitate healing. We used to recommend ice. Get rid of the ice, all right? Want that active recovery. Love, we're thinking about load, optimism, vascularization, and exercise. So we want to be able to make sure we're loading the tissue properly to tolerance. It shouldn't be painful, but you should be able to tolerate it. Optimism, know that your body's going to heal. Don't get depressed that you can't get back to things you're going to do. You'll be able to do that. You'll be just fine. Vascularization, we do want some movement, some active blood flow, some increased circulation. That will help you heal. And exercise, we kind of discussed already, things that you can progress gradually, getting you back, that you tolerate well, getting you back to where you need to be.